name is Cassandra Snyder Wyatt. I'm going to be doing my final assessment video for my NUR 322 class. Today is April the 19th, 2018, and I will be doing my assessment on Alyssa.
Okay, I'm just going to pan the room here. Whoa. Hope you don't get seasick.
Man, that's like a really good pan. All right.
Okay.
Knock, knock. Hi, how are you?
Hi, good. How are you?
Good. I'm going to provide privacy, wash my hands, ensure that all my equipment works, in which it does. Should not leave the light on. All right. I'm going to be your nurse today. My name is Cassandra.
Hi.
Can you go ahead and give me your name and date of birth?
Alyssa Hartman, 5896.
Okay, I'm going to go ahead and check that against your wristband here, and that matches. Okay, Alyssa, can you go ahead and tell me where you're at?
Lincoln University, Elif Hall.
Okay, and what's the date?
April 18th. April 19th,
Okay.
2018.
Okay, all right, perfect. So I understand you're here for a big, long head-to-toe assessment.
Yes.
All right, you don't sound very enthused.
Well, it's whatever.
All right, we'll go ahead and get started with your vital signs, okay?
Okay.
Are you having any pain today?
No.
Good. Like to hear no pain. We're going to go ahead and take your blood pressure. All right. Then you can just relax your arm. Alright, so your blood pressure is 120 over 78. So that is a great blood pressure. Go ahead and put that back. How tall are you, Alyssa?
I am 5'4",
5'4", and then how much do you weigh?
160.
Alright, perfect. I'm going to go ahead and take your pulse here. Alright, so I went ahead and checked her pulse and her respirations at the same time. Her pulse was 76 and her respirations 18, so that's good. Let's see, pain, height, weight, pulse, respirations, temperature. My goodness. Alright. Let me go ahead and do this number. Of course, I turned it off. Alright, now we're ready. .96, so that is absolutely perfect. Alright, so we're going to go ahead and move into the big assessment, and we're going to start with your skin. So I'm looking at your skin, and of course she would be in a hospital gown. It is dry, so there's no moisture. I don't see any lesions. Your temperature of the skin is cool. It's not super hot or super cold by any means. The texture is good. It's good, nice and smooth. I'm going to check your skin turgor, and that's good. Capillary refill, perfect. The color of her skin is absolutely fine. It is within normal limits by all means. So I'm going to go ahead and look at your scalp. I'm looking at her scalp. Her hair scalp is normal, clean, no dandruff. Her cranium does not have any kind of lesions or abrasions on it as well. I'm looking at her sinuses, her maxillary and her frontal sinuses. Do you have any pain whenever I touch around?
No.
No? Okay. And then we're going to have you smile and close your eyes. Don't let me open them. All right. So we're going to go ahead and move to the eyes. I'm going to have you tell me whenever you can see my hands, my fingertips, okay?
You can see them.
Okay? How many fingers am I holding up?
1,
Okay?
2, 3.
Okay. Perfect. I'm going to go ahead and check your vision here, your visual acuity. We are going to hold this 14 inches from your face. 14 is right there. Don't mind me as I fumble. All right, so I want you to read the smallest line that you can.
4, 2, 6, 7, 3, 9.
Perfect. I'll grab my pen light here, and I want you to follow my pen with your eyes, but not your head. Okay, I'm going to check your pupils. Look forward right at that mannequin's eyes. All right, and your pupils are reactive, so I'm going to keep my pen light in my pocket. Okay, so I'm going to go ahead and move to your ears. I'm going to look inside of your ears, as well as externally. So let me know if whenever I feel around on your ear, if it's any kind of tender, okay? Don't mind me playing with your hair. You have soft hair.
Thanks.
Is any of this tender?
No.
Okay, and her external ear looks fine. There's no redness. The skin on her ear is good. It's not broke down or anything. So I'm going to go ahead. I put a clean tip on my ear looker, otoscope, I think. Okay, turn on the light. Okay, your ears look good. I'm going to look on both sides. I'm afraid my little thing's going to fall off. Oh, there it goes. It clicked. Okay, your ears look great. So I'm going to go ahead and do a couple of hearing tests, okay?
Okay.
So we're going to start with the Weber test. So I'm going to put this on top of your head, and you're going to tell me if you can hear it. And then after you tell me if and when you can hear it, let me know whenever you stop hearing it.
Okay. I can hear it.
Okay?
Can't hear it.
Okay. We're going to go behind your ear. Can you hear it?
Yeah.
Okay, tell me when it stops.
Stop.
Okay? And then tell me whenever it stops.
Okay, it stopped.
Okay. Alright, so I'm going to go ahead and have you stand up real quick and face the window. We're going to do what's called a whisper test. So I'm going to stand a little bit behind you, and if you'll put one finger inside of your ear and move it around, I'm going to whisper.
C5-8.
Yes, and then do it to your other ear.
A6C.
Yes. All right. You can go ahead and have a seat. So I'm now assessing your nose. I'm looking at your nose. It is symmetrical. It doesn't have any kind of broken down skin around it, so that's good on the external surface. And we're going to go ahead and check the patency. So, okay. So that's good. I'm also now remembering that I should have checked some more stuff about your eyes.
Okay.
So I'm looking around your eyes, and I'm not seeing any problems with the external eye. I'm not seeing any bruising or lesions. Does any of this hurt?
No.
No? Okay, and then I'm looking at your conjunctiva. I'm not seeing any kind of drainage or any abnormalities there, so that's good. And we're going to go ahead and move to your mouth. Open your mouth for me. Ah, perfect. I'm looking at the top of your mouth, your hard, and lift up your tongue. Soft palates. I'm looking at your dentation. Your lips are pink and moist. Open your mouth again. And stick your tongue out at me. Perfect. I'm looking at your tonsils. And see, tongue, dentation. your inside, your gums were pink and moist whenever I looked at them. And I'm going to go ahead and feel your transmandibular joints to open up your jaw and close it. Okay? Let's see. Nose, mouth. Okay. So, now we're going to move to your shoulders. Can I have you stand up? Alright, we're going to do some range of motion. Okay? So let's go up and back and up and then all the way. Give yourself a hug. And then back in like you're scratching your shoulder blades, both arms. And then now brush your hair. Okay? And your elbows. Boxer. Not boxer. Okay, now act like you're holding a bowl of soup. And pour it out. Okay, now move your wrists up like a motorcycle. And then down. And then in. And out. Okay, don't move your arms. In. Okay, out. There you go. So now we're going to do your fingers. Close like fists. Open. Apart. And then together. Okay. So we're going to go ahead and do strength. So do your boxer pose again. Push me away. Okay. Pull me toward. Okay. Wrists. Pull towards your nose. Okay. And then push. Alright. And then make your fingers wide. Don't let me push them together. Okay. And then now just normal. Like a little, yeah. And then try to make your thumbs go to your pinkies. Don't bring your pinky to your thumb. Okay. Alright, you can go ahead and turn toward the camera backwise. Yep. Move your hair. Perfect. So we're going to assess her anterior, posterior chest. And whenever I place my hands on you, you're going to say, I want you to say 99, okay?
Okay.
99. Okay.
99. 99. 99. 99. 99.
Okay. And then I'm going to percuss as well. I'm going to start top. I'm going to make sure to avoid the scapula whenever you are percussing. Alright. We're going to listen to those same spots. Alright, so normally you would go ahead and have them take a deep breath in and then out with each place that you place your stethoscope for, but for time and video purposes, we're just going to go ahead, breathe in, breathe out, breathe in, breathe out. Breathe in and out. In, out, in, and out, in, and out, in, and out, and then in, and out. Okay. And of course, you know, like I said before, they do have a gown on at this point because you would like to listen under clothes more than you would on top of clothes. I'm now going to feel around on your spinous processes, so let me know if anything is tender.
No.
No tenderness?
No.
Okay. And then I would be looking at her skin. I don't see any redness, rashes, abrasions, any kind of lesions, anything like that. Her skin looks fine back here. Her pigmentation and color is fine as well. Let's see. Okay. I'm going to go ahead and have you sit down on the bed. And move your hair again for me. We're going to go ahead and do pretty much the same thing on your anterior chest. Your skin looks good. The color is good. No lesions, no abrasions, so that's good. We're going to palpate. Let me know if there's any tenderness. No tenderness? No. Okay. We don't do tactile frenitus, but we do percussion here, so. No, you're fine. Don't mind me. Sorry.
Whoa.
Okay, and then we can go ahead and auscultate. Breathe in. And out. In. And out. In. And out. Okay. In. And out. In. And out. In. And out. Okay. I'm just going to keep this on because we're going to move to the heart. And I'm just going to listen to the heart, and then we'll go back and do some palpations. Okay. So we're going to listen to the aortic portion and the pulmonic. All right, and can you lift your breasts up for me? Tricuspid. Mitral. Okay, and then lay on your left side. Perfect. We're going to listen to the... Perfect. We're listening to the apical pulse here. Just while you're here, I'm going to go ahead and feel for your point of maximal impulse. Can I feel it? Go ahead and sit up and lean forward. Thank you. We're going to listen to the inside left sternal border here. And again to the apical pulse. Okay? And I do not hear any murmurs, so that is a great sign. We're going to go ahead and feel for any lifts, heaves, or thrills. Go ahead and breathe normal. Okay? And I also, whenever I was inspecting her anterior chest, I would like to note that I already took her respiration rate, which it was 18, and it was deep, even. She's not using any kind of accessory muscles to breathe deep, even in regular. So, that's great. We are done with that. So if I could have you lay down, we're going to inspect your abdomen. And if you could lift your shirt up for me. Perfect. So we're looking at the contour of her abdomen. There's no abnormal rounding. I don't see any pulsations of any kind of intestines, so that's good. Even if there was some, that would be okay as long as we note it. I'm looking around her umbilicus, and I'm not seeing any kind of signs of an umbilical hernia, so any kind of abnormal rounding or things like that. Her skin is intact. There is no bruising, lesions, anything of that sort, and the color is as the rest of her body is. It is fair. I'm going to go ahead and listen. Listening to all 4 quadrants and for at least 15 seconds. Okay. Her bowel sounds are normal, so we're going to go ahead and do some percussion. So I'm going to tap on your belly. This is an awkward angle. Okay. We're going to palpate, so I'm going to rub in a circular motion, and if anything is painful, let me know, okay?
Okay.
So we're going to go light palpation. Any pain?
No.
No? Okay. We're going to go a little bit deeper. Still no pain? All right. Perfect. So I can go ahead and have you sit up at this point. And I just remembered that I should do some range of motions on your neck. Okay. So look down and then back up. Look side to side, left and right. Okay, and then put your ear to your shoulder. Perfect. All right. So we're now going to move to the bottom portion of your body, your lower extremities. So I'm going to have you pull up your legs of your pants. I'm looking for symmetry in her legs. And then once again, she would be in a gown so I could see all of her legs and not just her calves. But for what I can see, they are symmetrical. The skin is normal. There's no lesions, abrasions, anything like that. Temperature is warm. Hair distribution is even. We're looking for any kinds of signs of edema, which I don't see any, so that's great, especially no pitting edema. We're going to go ahead and feel the popliteal pulse behind the knee. Okay. The posterior tibialis pulse. And then our pedal pulses. Perfect. I'm also going to go ahead and check capillary refill on her toes, which is good. Her toes are warm, so her whole lower extremities here is good. Can we pull your toes to your nose and push against my hands? Perfect. We're going to look for a Babinski sign here. Lift up your leg for me. Okay. Are your feet ticklish?
Yes.
All right. And those are normal findings. I'm going to go ahead and have you jump up. We're going to do some range of motion here. All right. So let's put your hip out. Well, we'll go to the side of you. And then back. And then back again. And then out like this. And then back in, cross your other leg. Perfect. Breathe. Alright, so now we're going to do your knee. So pull it up. And then go back. Outside. And then inside. Perfect. And then we'll do ankles. So I'm going to go ahead and have you walk over to that wall over there normally. Okay? And then turn around. And then walk back heel to toe. Perfect. I'm just looking at your gait, which is good. Alright. So I'm going to have you face the camera here and close your eyes. Excuse me. Close your eyes. And we're looking for any abnormal swaying. And is your feet together? Yep. Okay. And we would do this for 30 to 60 seconds. So go ahead and sit down. Alright. So I'm going to go ahead, have you move your feet up, down, in, out. Perfect. We're going to do some coordination stuff. So I want you to take your hands like this and then move your pinky and your thumb to all your fingers. Perfect. Alright, now put your finger on your nose and touch my finger. Okay, back to your nose, finger, nose, finger, nose, finger, nose, finger, and then to your nose and my finger. Perfect. Alright. So, let's do some reflexes. That seems like the right thing to do. I'm going to have you hold your arm out, just like that. Yep. So we're going to go ahead and check the brachial reflex here. Okay, your finger curved, which is what I was looking for. Okay. We're going to go to the patellar reflexes. Did you do that?
No, that's you.
Okay, and then the Achilles, like this. We're going to use the long side here. Okay. Perfect. Now we're going to do some sensory stuff. So I'm going to have you close your eyes. Then I'm going to put an object on different portions of your body, and you're going to either tell me if it's sharp or dull, or then at some point I'll ask you where you feel something. You're going to tell me where you feel the slight sensation, okay?
Okay.
All right, so close your eyes. Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Okay. Sharp or dull?
Sharp.
Okay, sharp or dull?
Dull.
Okay. Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Okay. Where do you feel this?
On my pinky. Right pinky.
Okay. Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Okay. Sharp or dull?
Dull.
Okay. And then sharp or dull?
Dull.
And then sharp or dull?
Dull.
Okay. Let's go. Where do you feel this?
My left pinky.
Okay.
Toe.
Sharp or dull?
Sharp.
And sharp or dull?
Sharp.
Where do you feel this?
My big toe on my right foot.
Okay. Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Okay. All right. I think that concludes our assessment. So, I'm going to give you your call light.
Okay.
Can I get you anything?
No.
No? Are you comfortable?
Yeah.
All right. Thank you for letting me look at you.
Thanks.
And I'm going to give all this information to the physician, and he'll be in, okay?
Okay.
All
Thanks.
right. Thank you.